Today we will be discussing about nasal septum. What is nasal septum? Nasal septum is the central partition of the nose that separates the nasal airway into right and left nasal cavities. It also helps to support the dorsum of the nose and the tip of the nose, and it also forms a part in the nasal valves. Before explaining the nasal septum, just look at the image. So in this image, you can see the ethmoid bones, the sphenoid, the rostrum of sphenoid, maxillary and palatine bones. We are looking at the septum from the side. You can also see the image in which I have depicted the anterior, posterior, superior, inferior, caudal. Okay, so we'll be saying our attachment based on this anatomical orientation. You have to keep that in mind so that you will be able to understand it better. The nasal septum is bony and cartilaginous. That means there's a bony part and a cartilaginous part. What are the bones that contribute to the septum? The most important ones are the perpendicular plate of the ethmoid bone and the vomer. Other bones are the maxillary crest, anterior spine of maxilla, and the palatine bone also have contributions to the nasal septum. Perpendicular plate of ethmoid forms the upper 1/3 of the nasal septum. You can see the image. This is the perpendicular plate of the ethmoid. So it forms the upper part and also a little bit posterior. So upper 1/3 is formed by the upper means you're telling it towards the root of nose. So upper 1/3 is formed by the perpendicular plate of the ethmoid. The perpendicular plate of the ethmoid is continuous superiorly with the cribriform plate and the crista galli. Posteriorly, the perpendicular plate of ethmoid attaches with the sphenoid crest. Posto-inferiorly, it attaches with the vomer. From the image, you can see that vomer is below the perpendicular plate of ethmoid. So posto-inferiorly, it attaches with the vomer. Antero-inferiorly, it attaches with the septal cartilage. The second bone is the vomer. Vomer forms the posterior and inferior part of the septum. Vomer has two ali that articulates with the rostrum of the sphenoid bone. This creates the vomerovaginal canal through which the pharyngeal branches of the maxillary artery travel. The inferior border of the vomer articulates with the nasal crest formed by the maxillary and palatine bone. So if you imagine this is nose, inferior part you have the maxillary and palatine bone. Superiorly you will have the ethmoid continuation and also sphenoid. So the articulations will be like that. So just have that 3D picture in your mind and then you can easily explain the articulations. And anteriorly, just like the perpendicular plate of ethmoid, the vomer is also attached to the septal cartilage. What happens to the posterior part of the vomer? The posterior edge of the vomer forms the posterior free end of the septum. What is the cartilaginous part? The cartilaginous part is formed by a cartilage known as the septal cartilage or the quadrilateral cartilage. So the septal cartilage is attached posteriorly with the vomer and the perpendicular plate of ethmoid, and it is bound firmly by collagenous fibers to the bones. Towards the bridge of the nose, the septal cartilage is continuous with the upper lateral cartilage. The septal cartilage is not an isolated cartilage. Along with the upper lateral cartilages, it forms a cartilaginous unit. A portion of the septal cartilage, known as the sphenoidal process or the septal tail, extends between the perpendicular plates of ethmoid and the vomer bone posteriorly. The significance is we can harvest this cartilage for rhinoplasty, especially in case of revision rhinoplasty, etc. We can harvest this cartilage and use. Where does the inferior part of the septal cartilage sit? The inferior attachment of the quadrilateral cartilage or septal cartilage sits on the groove formed by the maxillary crest, and it is bound loosely by connective tissue, forming a pseudoarthrosis. So this is actually helpful because in trauma and all, it is flexible. So it helps to prevent dislocation and fracture to some extent. Otherwise, this septum can dislocate from the maxillary crest and also from the groove in the vomer, causing dislocation of the septum that can block the airway. Septum also have another parts, that is membranous septum. What is membranous septum? Is the most anterior part, that is between the caudal part of the septum and the columella. You have a freely movable connective tissue. It is a double skin on both sides. There is no cartilage or bone inside. It is freely movable. That is membranous septum. Some books talk about a columellar septum also. That is a columella containing the medial crura of alar cartilages united together by fibrous tissue. That is columellar septum. So septum proper made of bone and cartilage, membranous septum and columellar septum. There are studies that shows that nasal septum also plays a role in the maintenance of the airway. There is something known as nasal septal swell body. This is a widened region at the anterior nasal septum located anterior to the point of the middle turbinate at the level of the internal nasal valve area. This histopathology shows that this area is having lot of venous sinusoids that can manage the airway, like the inferior turbinate. It can enlarge and reduce, and then it can play a role in the maintenance of the airway. What is septal deviation? In all these images that I have shown you previously, you are seeing a straight septum, a straight image you are seeing, but in real life it is not so straight. A small minor amount of deviation is okay. It is just an anatomical variation. 90% of the people will have a slightly deviated septum. What causes the deviation of nasal septum? It can be either developmental or traumatic. Developmental occurs during the development of the embryo. The nasal septum is formed from the tectoseptal process, which descends to meet the two half of the palate. The palate is coming to fuse, and the septum is also coming. When it comes and fuses with the palate, during primary and secondary dentition, changes occur in the palate, and the palate descends and widens to accommodate the tooth as the tooth develops. So, any unequal development between the palate and the skull base will cause a deviated septum. A buckling of the septum all can happen because it is attached, and one thing is not growing properly means this can bend or stretch. In children with adenoid hypertrophy, mouth breathing, the children will be having a high arched palate, and hence the septum will be deviated, because see that this is the palate, this is septum, and if the palate is coming up, naturally the septum will get deviated. Septal deviation is also seen in cleft lip and cleft palate. Septum due to a developmental issue can be a C-shaped or an S-shaped. C means it is deviated to one side. S means it is deviated to both the sides. It can have smooth borders. Trauma means any trauma to the nose, a lateral blow to the nose or a crushing blow to the nose. Everything can cause displacement and deviation of the septum, which can be fractured, dislocated, and irregular deviation can happen. Other factors that can influence a deviated septum are some racial factors and hereditary factors. What are the types of septal deviation? As I said before, there is anterior dislocation, that is septal cartilage is dislocated. Then a C-shaped deviation or an S-shaped deviation. But septal spurs I'll be explaining in another video. Spur is a shelf-like projection. There is a projections present between the cartilage and the bone due to the septal deviation that can compress onto the inferior turbinate, and it can compress on the lateral wall of nose, etc., and cause headache and other symptoms. There are different classifications of deviated nasal septum. One classification is based on its extent towards the inferior turbinate. It is 3 degrees. Degree 1 is not reaching the inferior turbinate. Degree 2 is reaching the inferior turbinate. Degree 3 is reaching and compressing the inferior turbinate. Other septal deviation classifications are also available. I'll give that as a table. You can keep that in mind and remember when you are assessing a patient. I'll be discussing about the problems caused by nasal septal deviation and the treatment for a deviated nasal septoplasty or submucous resection of septum and endoscopic septoplasty in another video. Summarizing, the nasal septum is bony, cartilaginous. Bony part is contributed by the perpendicular plates of ethmoid, Vomer. Then you have maxillary crest, Palatine bone. The septal cartilage is also known as the quadrilateral cartilage. Also, there is a membranous and columnar part to the septum. Blood supply of septum, I have done as a separate video. Please go through that video to learn about the blood supply of septum. Hope this helps. Thank you.